You're a doctor, correct?
Correct.
And you're a psychiatrist?
Yes.
How long have you been a psychiatrist for?
Since 1987.
And you went to medical school?
Yes.
What medical school did you go to?
Northwestern University.
Now, Johnny Depp was a patient of yours, correct?
Correct.
You understood that Mr. Depp had substance dependence issues, is that correct?
Yes.
Do you recall what substance issues, what substances Mr. Depp had issues with?
Marijuana, alcohol, opiates, I believe.
Did you ever have an understanding that Mr. Depp had anxiety syndrome?
I knew Mr. Depp had anxiety.
And how did you come to be aware that Mr. Depp had anxiety?
He told me that.
Do you recall having any conversation that Mr. Depp was bipolar?
There was some question about bipolar disorder diagnosis, but I do not remember any specifics about the discussion.
Do you recall having a conversation with Mr. Depp about a bipolar diagnosis?
No.
What behaviors did Mr. Depp acknowledge that should be changed?
Certainly his drug use and his turning to drugs to help relieve a lot of the psychic pain that he was experiencing.
In working with Mr. Depp, would you agree that that Mr. Depp had fundamental issues with anger?
I would say that he expressed having issues with anger.
Mr. Depp expressed having issues with anger?
Yes.
Did Mr. Depp express having issues of anger towards Amber?
He expressed having anger towards her. Yes.
Do you recall what reasons Mr. Depp told you as to why he was expressing anger towards Amber?
I can't, no, I'll have to say no.
In working with Mr. Depp, was he ever suspicious of Amber having affairs?
I can recall now he expressed feelings of jealousy, but I don't remember if it was about affairs.
Do you recall any more detail about what Mr. Depp was feeling jealousy toward Amber about?
No.
In working with Mr. Depp, did you see that Mr. Depp had any issues with patience?
Yes, he was impatient.
What is your understanding about issues that Mr. Depp had with Amber?
It was a very chaotic relationship with a lot of fluctuations and ups and downs and lots of difficulty in emotional expressions and lots of anger in both places and high intensity affect and emotional expression.